Good morning, good evening. Welcome, everyone. We are just kicking off our agenda today, and I am so thrilled to welcome you all to our webinar. Today, we're focusing on gender in the pandemic, the gendered impacts of COVID-19, really spotlighting Nairobi youth, voices, and experiences. And we're just really thrilled to present this program today. What we're going to do is really unpack some of the gender dynamics of the COVID-19 pandemic. We are going to have a chance to hear from Dr. Rosemary Morgan, looking at that global lens on the gendered impact of COVID-19. We're going to go deep into our recent study in partnership, Johns Hopkins in partnership with ICRHK, really hearing from youth on just a range of health and social and economic impacts that youth have had as a result of the pandemic. So we'll sort of do a deep dive into the results from that. And then we're really thrilled to have just an excellent panel of leaders in gender policy, in OBGYN, in economic development and empowerment to really reflect on those results, put them in context of where we need to be going programmatically, how do we recover from this? And then interspersed throughout, we're really pleased to present the voices of youth through a storytelling format. And we're really pleased to present that in partnership with Stoop Stories, which is a Baltimore-based excellent storytelling program. And then we're able to do some training with our youth in Nairobi to bring those voices to light. So before we sort of kick off the program, I just want to really acknowledge and thank, we're thrilled to have the support of the Bill and Melinda Gates Foundation for this work, as well as the Alliance for a Healthier World. And I want to also thank just all of the teams at Hopkins, at ICRHK, through the Alliance as well, in terms of getting this event prepared and produced for all of us. So just really excited to kick this off. Our call for action, our social media invitation to participate online is just join in the conversation, gender in the pandemic, PMA gender. And this is going to allow us to continue to spread the sort of the impressions and the dialogue that we're going to have today with others that are interested in understanding the gendered impact of the pandemic. And I'm just thrilled to present Dr. Rosemary Morgan right here at the Johns Hopkins School of Public Health. Dr. Morgan is going to present really again on that global evidence base on gender and COVID. She co-leads and has co-established the Gender and COVID Working Group, which is a global multidisciplinary international group that's really looking at the gendered impact of COVID-19. So Rosemary, over to you.
Great. Thank you so much, Michelle. And I'm delighted to be here today to present to you on the gendered effects of COVID-19, looking more at the global trends and impacts. And hopefully once I'm finished with my presentation, we can go back and hear those stories, which I'm really excited to hear about today. So if we can move on to the next slide, please. We know that COVID-19 is not gender neutral. Well, we know that pandemics are not gender neutral. You know, we knew that before COVID-19 came. We have evidence from Ebola, from Zika, for example. Even epidemics like influenza all have a gendered nature. And that's really because, you know, society is gendered and the structures and systems in which we live are not equitable, not only gendered, but looking at other social and structural inequities and the ways in which gender intersects with race and class, for example. Next slide, please. So what do I mean by COVID-19 is gendered or pandemics are gendered? What I mean is that women, men, and gender minorities are differentially and often disproportionately impacted. And one thing that we like to do is think about the different types of impacts so that there are primary and secondary impacts, or you might think of them as short-term versus long-term impacts related to social, economic, security, and health related effects, both related to sex and gender. And this distinction is important. When we look at sex, we're talking more about biological impacts, whereas gender is more related to the social structural impacts. So while the global policy is created to respond to outbreaks, that is often itself very gender neutral, And we see that outbreak responses are consistently failing to meaningfully include gender analysis, despite the fact that we know that COVID-19 is gendered. And the interesting thing is, COVID-19, unlike kind of Ebola and Zika, even though we had evidence, has really shone light on this. And I've put on the slide here 2 papers that we've written this year that really are highlighting the gendered impacts of the outbreak, if it's something that you'd like to look at in more detail. So next slide, please. So Dr. Decker mentioned that I am part of a larger group. We're seeking to understand and mitigate the differential gendered effects of the outbreak across 9 countries. I also host a larger international COVID-19 working group, which is a Google group of over 600 people that are really interested in working on these issues. So we're hoping, like, through this, we can really bring that international lens to our work. And today I'm going to really touch upon sort of key trends that we're seeing worldwide, really. So next slide, please. So I have put on this slide a kind of a list of the different gendered impacts. So we do know that there are greater rates of, so men or women or different groups have greater rates of infection, mortality, and morbidity. We see among some groups an increased economic insecurity. We're seeing lack of access to sexual reproductive health services, including maternal health, increased rates of domestic violence, an increase in informal care responsibilities, reduced access to education for girls, and an increase in teenage pregnancy, a lack of women's voice and agency, especially in COVID-related decision-making, and an increase in stress and mental health issues. And I mentioned previously that we're seeing differential and sometimes with disproportionate impacts. So the very first point on there is the health-related impacts. We are seeing more men, for example, having increased infection, increased mortality, and in some cases, different morbidities in terms of being in the ICU. But if you look at all the other points underneath there, those are the secondary impacts. We are seeing disproportionate impacts on women, as well as sexual and gender minorities. So I'm going to highlight a few key examples. Next slide, please. So what about some of the health impacts? So this slide comes from Global Health 50/50, and they are really providing real-time sex desegregated data. And I would encourage you to go and look at their website. It's very interactive, and you can explore some of this data in real time. So as you can see here, for every 10 females, regarding tests, there are 8 tests in men. So more women are being tested for COVID-19. For every cases, we see almost pretty equal rate of actual cases among men and women, but where we're seeing increased differences is in hospitalizations, ICU admissions, deaths, and confirmed cases that have died. We are seeing greater impact on men. And I do want to highlight that gender does intersect with other social stratifiers like race. So in some contexts, we're seeing disproportionate impact on communities of color in particular. Next slide, please. Looking at health impacts, these are the confirmed cases among healthcare workers. So this is interesting because we do know that healthcare workers are the majority of healthcare workers are women worldwide, about 70 to 80%, depending on where you are. However, women are being disproportionately infected with COVID-19. And there might be various reasons for this, including the types of care they're doing, inappropriate personal protective equipment, for example. Next slide, please. Moving on to economic impacts, women, and particularly women of color in many contexts, are being disproportionately impacted. Here's just some data from Canada and the US, for example. In Canada, from February to September, the number of mothers who work less than half their usual hours increased by 70% compared to 24% of fathers. And this is often related to care responsibilities in the home. In the US, it was estimated that in December this year, so 2 months ago, of all the 156,000 jobs that were lost, all of them were held by women, the majority of which were Black and Latina. Next slide, please. What about the social and security impacts? Well, I mentioned the increased rates of domestic violence, and we're seeing this across the world. So just an example from Peru, between March and July, calls to domestic violence helplines increased by 48%. Thinking about education and the impact on adolescence was what we're talking about today. It's estimated that 1.5 billion students worldwide, more than 11 million girls particularly, may not return to the school due to the pandemic. And this does have effects on poverty and risk of child marriage. And the Save the Children estimates that 500,000 girls are at increased risk of child marriage. And if you see there on the right, here is an article that's really highlighting the dramatic rise in Kenya of early pregnancies amid these school closures. And this is going to have long-term impacts. Next slide, please. So what can we do about it? Well, we recently put together this brief about creating a gender responsive pandemic plan. We need to recognize the ways in which the pandemic is gendered and have very specific policies that address these disproportionate needs. And you can go to our website to have a look at this brief to find out more. Next slide, please. But what is a gender responsive pandemic plan? Well, it is one which takes into consideration the intersectional needs. And by that, I mean looking at how gender intersects with race, age, class, for example, disability. So the intersectional needs of women, men, and gender minorities in all stages of pandemic response. And it includes considering and addressing how the different groups experience differential primary short-term and secondary long-term social, economic, security, and health impacts. So we must not only focus on the health impacts like testing, and which is, testing is important, reducing cases and infection rates are very important, but we also must address the secondary long-term impacts which disproportionately impact women and gender minorities. Next slide, please. So I just wanted to end with an invitation to those on the call to please, if you're would like to join our Gender and COVID-19 Working Group Google group. There's about over 600 members. You can go to our website, the Gender and COVID-19 website, to join and we'll get on the Google group, and it's a place to share resources and share successes and challenges, for example, and all are welcome. Next slide, please. And with that, I will say thank you very much, and I will hand it back to Dr. Decker.
All right. And for this next portion of the program, I'm actually thrilled to sort of introduce myself and my counterpart in this work, Dr. Peter Gitanji from International Center for Reproductive Health, Kenya. This is the portion of the program where we really wanted to share with you the study results from the PMA study that we just completed, round one, data collection, qualitative interviews, and focus groups, and are getting ready actually for the second round of survey data collection. So I'm going to give you sort of the first half of the results presentation, and then I will turn it over to Dr. Gitanji. So next slide here. Thank you. Next slide. Great. So just to give you some grounding and some background on this study, back in 2019, we had implemented a respondent-driven sampling survey with youth in Nairobi. These were unmarried youth ages 15 to 24, and we recruited them through respondent-driven sampling because this is a population that is sometimes transient, moving back and forth between places with work and school, and we implemented the RDS there. Through that study, we identified some unmet contraceptive needs as well as gender-based power imbalances. So when the pandemic hit in 2020, we re-engaged this cohort to really start to track and characterize the gendered social, economic, safety, GBV impacts of the outbreak. We did this through gender stratified quantitative analysis and through the qualitative as well, really paying attention to how gendered social and economic power dynamics and underlying norms and inequities might play out in various aspects of health and well-being and economic impact through the pandemic. So next slide. So we implemented a comprehensive mixed methods data collection here. The quantitative portion was a phone-based survey. We did that from August primarily in September, a little bit into October. You can see at the bottom there sort of the timing of the data collection within the overall case trajectory within Nairobi. We actually hit it within a little bit of a lull in between sort of two peak areas. And we ran the phone-based survey in 2 sessions just to sort of minimize participant burden and keep that in experience as short as possible for our youth. We had just over 1,200 participants, and that translated to about 94% retention from our 2019 survey. So we're really thrilled to get such a high level of participation. We've got a 6-month follow-up survey under development for March. And then we're also implementing sort of a mini survey, a text-based mini survey to track some key indicators over time. Our qualitative methods that accompanied this were virtual, and they included youth focus groups, stakeholder focus groups, practitioners, as well as key informant interviews with higher level stakeholders. And we ran as well a series of in-depth interviews with purposefully selected survey participants. As you can imagine, there were a number of ethical protections that needed to be in place here. Audio sort of privacy screeners for that phone-based interviewing, as well as provision of resources for health, for mental health, for gender-based violence, all consistent with best practices for violence and other sensitive topics. Next slide. So we're going to share with you just a little bit about who was in our study, hit some high points on gender differences in privacy and access to technology, certainly the economic impact, transactional relationships were a big part of that, safety, gender-based violence, very interesting gender dynamics there, and then turning again, of course, into the health impact of this, contraceptive disruptions, menstrual hygiene access, and really ending with our reflections and results on mental health and social support. So next slide. So just to give you a sense of who is in our study, we had a really nice age distribution here. Of course, our cohort had aged slightly. They were, 15 to 24 in 2019, and they had aged 1 year, of course, in the intervening period. So we had a little bit of a skew up to the upper end of that distribution, the 22 to 26 years, a nice range of education experiences. And as you can see from the pie chart, there was a fairly nice balance in terms of students and working in the informal or sort of gig economy. And those were the 2 sort of dominant groups in terms of what were these youth doing before the pandemic hit. So you can kind of bear that in mind as we move through the rest of the presentation. Next slide. So one of the first things we wanted to understand was just privacy and time at home. Of course, the COVID-19 restrictions prompted basically everybody to spend a lot more time at home. And this was true in our study as well. Both men and women were reporting spending much more time at home. Other household members were also spending a lot more time at home. This varied a little bit by family member and household composition, of course. But this was really interesting in terms of understanding the constraints on adolescents and young adults who are transitioning into independence and really need a little bit more privacy. What was very interesting about this was that these privacy and time at home restrictions, sorry if you can back up, yep, had actually a mixed impact on time with partners. So about 45% of our youth were spending more time with their partners, and just over a third were spending less time with their partners, and there were no gender differences in this. We thought this was really important to understand because those partnerships, again, are going to be the context for potentially unintended pregnancy, potentially gender-based violence, potentially also sources of support. And so understanding the relationship dynamics that come into play as a result of this, really important. And you can see here an example from one of our survey, one of our qualitative participants. She's telling that spending that time at home, it's actually really hard to spend time with peers as well as partners. So next slide. With that, however, the decreases in privacy within the home, felt privacy within the home, were really falling disproportionately to young women. So you see young women in the purple here, 75% of them were reporting that they had less privacy than they did prior to the pandemic. Whereas for young men, it was really a mix. Some of them actually had more privacy, some of them had less privacy, so that was much more mixed. And then on the qualitative quote, you can see the impact on this is that, having all of these people home, now you maybe want to get dressed and you're sort of stuck in there, and there's just no privacy for you as a girl, as a woman, right? So really having this, we're really starting to see this gendered impact. Next slide. We also saw differences, and one of the things we were really concerned about were access to technology, and access to private use of technology so that youth can engage in education activities, so that they can connect privately, potentially with support services. And so we saw some gender differences here in terms of ability to safely and privately access the internet. You see in the light blue column there, you see that young men are much more likely to say that they always have safe and private access to the internet. There's a real gap there for young women. In the sometimes category, we're seeing a little bit more equity, but there are some real gaps there that I think that we're seeing as well. The vast majority of our youth have access to a mobile phone. Obviously, that was part of how they participated in the study. But computer access was much less, as we might expect in this population, 15% of young men and only 8% of young women. The chief limitations that we see here to internet access are cost of data for both men and women. And then the device sharing issue, lack of access to your own device, was sort of the second most common limitation, 31% of women and 26% of men. So we see a little bit of a gender disparity there as well. Really important when we think about shifting so much of our social, economic, and education lives to technology. Who has access to that technology is a really important question here. Next slide. So the economic impacts, I think it's very evident that, and we heard this from Dr. Morgan as well, widespread disruption to income generation. We absolutely saw that in our study as well. And then we see that 45% of young women and 45% of young men, 53% of young women, not able or at all or not able to meet basic needs since those COVID restrictions began. And then you see a much smaller proportion of both men and women being able to meet those basic needs. In general, we saw that women had much greater difficulty meeting their basic economic needs. And you see that reflected in the quote as well, in terms of family members maybe used to work in a certain industry, there's job loss, there's a breadwinner becoming one person, and maybe even in some families, both breadwinners have lost their jobs. So one of the things we really wanted to understand was how severe this economic toll has been and how it has fallen on gender lines. And we see that there is some symmetry, but it's definitely amplified for women, the way that we heard as well from Dr. Morgan. And what we also wanted to understand was sort of that, you know, especially for our youth that were previously engaged in school, what are they doing with time now? What's the time substitution? So we did see that gender differential in daily time use, so that young men much more likely to spend their time on income generation activities, whereas young women's time was much more spent on caregiving and household tasks. So when you start to see that gender stratification, really concerned about economic recovery and a longer term gendered impact on that economic recovery. Next slide. Transactional partnerships, really important to be thinking about when we look at the gender wage gap and when we think about the gendered economic impact. So we know even pre-COVID, transactional partners are a very common way for young women to meet basic or socially dictated needs. Certainly in this study, we found that just over a third of young women in our study had either started or continued a relationship, really for that exchange of resources. Now, what's interesting about this and important to note is that most of those transactional relationships were actually spanning both before COVID and during COVID. So COVID didn't necessarily prompt new transactional relationships, but for almost half of our women that were involved, the economic dependence really increased during the pandemic. So we're starting to see those gendered economic and social systems play out in these transactional relationships. Next slide. We also were very interested in understanding about violence and safety. We know that youth bear a disproportionate burden of violence globally, as it is the case in many places. Certainly in Kenya and Nairobi, gender-based violence is pervasive. We had actually, we saw here that young men and young women both were much more likely to feel a sense of safety at home as compared with public spaces which were considered less safe. This was a bit of a surprise to us because we had thought that there could be some increases in safety threats in the home, but by and large, youth felt that their homes had greater sense of safety relative to the general public. Safety concerns in general were much higher for women. 1 in 5 young women reported not feeling safe at all in public. And then the gender disparities within what that safety looks like are also very interesting for us as we see. So next slide. So when we asked about a number of different sources of violence based on our qualitative and a number of other news media and stakeholder inputs. So we saw here that police fears and contacts with police were much more common for young men. They weren't limited to men, but they were amplified absolutely for men, often around mask wearing compliance and curfew compliance. So you see that about 31% of our young men were afraid of police when leaving the home, and 60% of them reported that they had had an interaction with police since COVID-19 had begun, often reflecting demands for money or other types of things. And you see here reflected in the quote as well, this concern that among young men that you might meet police along the way, they could beat you physically, which is abusive. So the safety issues for young men really centered around police. Next slide. Then we see for young women, there was a lot of discussion about sexual violence and where this might be coming from. What we saw here for the past 12 months, we saw that about 8.7% of young women in the past 12 months had reported some form of sexual violence from a partner. And then a smaller portion, 3.7%, had reported sexual violence from a non-partner. And so when we look at sort of those Venn diagrams, we see that sexual violence is absolutely an issue within the pandemic. And a good portion of it is really coming from people that they might be in a dating relationship with or already known to them. Really important to understand where this is coming from. And you see this illustrated as well in this quote where a young woman is explaining, because of these curfews, now you might be with somebody and you can't go anywhere. You're sort of trapped in the house with someone because of this curfew issue. So these issues are really converging for young women in particular. Next slide. And then, of course, intimate partner violence. We heard from Dr. Morgan about the issues around gender-based violence globally. We see this for young women as well. We see that about 17% of our sample had experienced physical or sexual partner violence in the past 12 months. Some of this was happening only since COVID had begun, but a good portion as well, 27% were experiencing this both pre-COVID and during COVID. So again, COVID is not necessarily creating new risks, it may be amplifying them. Help seeking was very low. This is such an actionable point for us as public health practitioners. Help seeking was very low, it was only 11%. And actually only 1/3, just over a third of young women had received information about violence support services since the beginning of the pandemic. This was most often through media, but this is something that we would love to see sort of coming up in this setting. All right, next slide. And I am actually now going to turn us right on over as we transition into contraceptive patterns and the health impacts of COVID-19. I'm going to invite my colleague and co-PI in this endeavor, Dr. Peter Gitanji, to share the rest of this presentation. Dr. Peter, over to you.
Thank you, Dr. Decker. Thank you, Dr. Morgan, and thank you for all of us who are present here. In terms of contraceptive disruptions, indeed, we saw that COVID, as would have been expected of pandemics, had some disruptions in terms of access. The health facilities may have been closed. People are fearing to get infected. In fact, fear of COVID infection at health facilities was the biggest of the challenges people are experiencing, while the closure of facilities was second in terms of the frequency. Next slide, please. Now, if you look at the difficulties in accessing coito-dependent methods, we see that indeed there are challenges for both less effective, more effective, and most effective methods, depending on whether it's a woman or a young man. And indeed, this is, again, a finding we find that it's reflective of the gender aspect, the differential impact in terms of whether you're a man or you are a woman. Next slide, please. We see that there are issues about menstrual hygiene. And indeed, we find that about 52% of our participants did express having concerns about menstrual hygiene management. And indeed, part of our participants were from the low income areas, which they have been dependent on partners who provide sanitary towels. And indeed, lack of money was the biggest barrier in terms of managing and accessing menstrual hygiene management. Next. And I think for me, the common pathway for all the things we have said so far is the effect on mental health, because the things we have seen so far could be significant stressors. We know from before that pandemics do cause a lot of social isolation, a disruption in normal life, as we have seen before from Dr. Morgan and now Dr. Decker. And indeed, those changes can lead to mental health. The biggest challenge for us and the concern for us is that if there is increased mental health in situations in countries like Kenya, where the infrastructure to manage mental health is limited, then this can be a problem. And therefore, the need to monitor whether we are having mental health issues related to COVID-19. Next slide. And here we are looking at a gender symmetry in terms of depressive illness. We use the patient health questionnaire, which is a 2-question screening tool. And of note is that we have between 45 and nearly 55% of our young men and women expressing some symptoms of depression or anxiety, retro interest or pressure in doing things, feeling down, depressed, or hopeless. Again, we see between 55% and 43%. So clearly, looking at this particular slide, we see there's an issue regarding mental health, and hopefully we can now go into deeper details to understand what is indeed the magnitude of mental health in relation to COVID-19. Next slide. And Dr. Morgan already mentioned about the impact of economic impact, where this job losses, as illustrated in those 2 quotes from our participants. Indeed, loss of employment, inability to maintain one's roles and responsibilities, disruptions of normal lives has a lot of impact in terms of mental health. And we see that indeed about 30% of our women and 27% of our young men had probable depression from the screening and from the questions we did ask them. Next slide. Now, do you see gender differences in terms of economic impact and depression? Yes, indeed, we see that people are very able to manage their issues. Their depression was about 6% for girls, 13% for boys. Somewhat able, about 20% for girls, 24% for boys. But let's look at not able at all. We notice that here, disproportionately, the girls are more affected, about 54% versus 20% of the boys. So again, what Dr. Morgan had mentioned earlier, gender differences, again, we see globally, and they are also reflected in our findings in Kenya. Next. What is the positive finding from this study? That yes, although mental challenges, health challenges could be there, we do have a support system where about 87% of our participants would have someone to count on when things go wrong. And this is important because that is a form of support, while 86% reported they have ability to get emotional support. Again, a very important component when you're looking at mental health. So this is important. It's something we can harness. But we also notice that mothers were the predominant form of support. And this is borne in the next slide. Next slide, please. That yes, indeed, the social support was mainly from the mothers, friends, and siblings. For those of us who are dads and fathers in this meeting, we are ranking number 4 there. So I don't know what we need to do more to be able to be a source of support for our young boys and girls. Next slide. So if you look at what is the context here, and indeed our president, His Excellency Uhuru Kenyatta, in the State of the Nation, did address the fact that we need to make sure that for the young people, they have a sense of purpose and self-esteem. And indeed, from these findings, we see that there are things we can do. And so from this survey, we see that there are lived experiences, which then we need to be able to take into consideration when you're looking at the perspective of the young people and the needs which they have and opportunities which we can be able to harness to ensure that their health or the impact of COVID-19 is taken care of. So indeed, the concerns of health, economic impact, mental health, safety, as we had seen earlier, which is related to police violence as well as violence in the homes, and gender-based violence are things we need to consider to be able to help our young men and women. Important is, as programmers, as people are interested in supporting young men and women, we need to have a gender lens when you're looking at the issues which are pertaining to young men and women. Next slide. So this is a summary of the things we have seen so far. So we'll not go into details, but indeed we have seen, if you're looking at privacy and access access to technology, we do have increased time spent at home and the consequences therein. And the implication there is we have seen gender-based violence, loss of privacy, and that has its own impact on the individual. We have seen issues about economic impact and the issue of gender imbalances there, where the girls are proportionately affected in terms of gainful employment and other important elements, and that we know have potential risk for the women as well as boys, but more for the girls. Gender-based violence, we have seen the issue of sexual reproductive health, access to contraceptives, and the consequence therein, for example, unintended pregnancies, abortions, and other things. So clearly there are areas we can be able to act on, and these results are indeed confirming what has been said globally, and there are really areas where we can action. Next slide. So what are the next steps? And I think Dr. Decker did mention this already. We are already collecting some information in terms of short messaging services to understand more in depth about the participants and the effect of gender and COVID. We are also able to follow up the survey in March, and we are now refining the tools to be able to say, yes, since we did this survey in last year, have there been changes over time? And there is also ongoing data analysis and triangulation with other data sets which are there, because in Nairobi, we benefit from the fact that we do have PMA core where we collect more information. And now this data from a select group of young women and men is important to be able to triangulate that information. Next slide. And with that, I would really like to acknowledge all the persons listed here who have contributed in one way or another to the realization of this particular study and this particular presentation and also this particular webinar. Back to you, Dr. Decker.
Oh, wonderful. Thank you so much. It's such an honor to co-present with you and collaborate with you on this work. So such a treat to get a chance to share this. And I'm learning that we are have attempted to resolve the sound issues. So I'm going to turn us back over to our Stoop stories for just a moment. And here we go. Over to you, Faith.
I came to Nairobi in July 2019, where I got a call from my uncle. And he told me he had something to tell me. I traveled from my homeland and came to Nairobi. After I arrived in my uncle's place, he told me that he has a friend who is employed in a company, and that friend of his has a shop, and that shop contains ladies' shoes, a boutique selling shoes. So that friend of his wanted someone to employ so that he or she can take care of the shop. I accepted the offer and I started working immediately. That July, I stayed with my uncle for the whole month. After I got my first salary, I decided to rent my house. I rented a single room, whereby I started buying my things slowly. I bought my bed, my television, almost everything. And funny enough, I hooked myself with a lot of people. I made friends faster. I made friends in the place where I was, in that boutique. And it was very good, and life was very sweet, because without friends and in this world, it is very difficult. So after I made friends, we started planning for parties. We were rocking that time. We were, I mean, we were rocking that time. We could plan, let's say, this weekend we move to this hotel. Next weekend we're going for swimming, we're going for hiking, for dancing. All those things used to happen. So near where I was working, there was a clinic, a private clinic. The time I was free, I could just move from my shop and go to that clinic just to make story, have fun. After that, those nurses and those people who are working there liked me, and they asked me if I can be going there doing locum, because my profession, I did certificate in health records and information technology. So they wanted someone who could be going, if they need that person, to go and keep the records of the clients there. Then I accepted the offer. I came back and waited for my boss. I talked with my boss about that offer. He accepted because he had a brother living with him, and that brother of him was doing nothing. So if in the clinic they'll call and say, Faye, we need you on Monday and Friday, just talk to the brother and say, on Monday and Friday I'll not be around, so make sure you come and take care of the shop. And that life was so sweet. It was very, very good. I enjoyed, because I was able to buy different types of clothes, expensive clothes. I was using expensive soaps, and my face was very smooth, and I was more beautiful, if I can say, and more likes. But now I don't use those things because I don't have money. I cannot be able to buy. So my life was good. I had different types of shoes. Now, after Corona came, it was very tough, because in the clinic there were no clients at all. So the administrator said that he will not be able to call anyone for locum for now until further notice. So I was okay. Then I went back to my shop. I was okay because I knew my shop was giving me a lot of money, and I was able to sustain myself. I was able to give myself anything I want. And that time I was having a goal body. That's goal body that ladies like, yeah. But after there, I stayed like for 1 month. Then my boss came back early. Then I asked him, why are you early? Why are you so early? He told me that he was sacked because in the company they needed few people due to this pandemic. So he was one of the people who was sacked. I was very embarrassed and I was very sorry. So he told me we cannot be in this shop together. So one must go, and that was me. I went back to my house. I stayed like for 2 months, eating what I saved in my account. After some few months, I used up to the end. I used up to the last coin which I had. I started selling my house assets. I sold all of them. Then I was remained with nothing. I decided to go to my cousin's place. She stays in a slum where I am now. Then I went there. She stay also in a single room, but there is a slum. So I stayed there for 1 week, and then I started applying again I started applying for jobs again. I started dropping my CVs in hospitals, asking jobs in hotels, in shops, but I couldn't get. And my life was miserable. I thought of getting married. I told my partner if I can move in with him. He said yes. But then again, I said this situation won't make me get married this early, I'm not ready just because of problems. No, let me focus and let me struggle with this problem. And my life ended just like that. And until now, I'm struggling to get a job. I'm really struggling, but I've not gotten any job. And I'm staying with my cousin now. We eat what we get. Life is not easy. Life is very, very expensive for now. I cannot get what I want. But I hope life will be better. And hopefully I'll get a job and sustain my life the way I used to. I really hope that will happen to me soon.
Wow. Faith, thank you so much. I want to let everybody on the webinar know that Faith is actually with us. She has been popping in and out here on the webinar. But I want to take a minute to really, Faith, thank you for preparing just a really beautiful picture, sharing what the experience has been and how it has shaped your experience in the COVID pandemic. And I also want to let you know that everybody on this webinar is sending you our best wishes. I know that the next step is going to come through for you. And we are all channeling all of our hope in your direction. So thank you again for sharing that. We thought it was so important to have these stories prepared, and I want to take a minute as well at this moment to just again thank our Stoop Stories collaborators for these. Our next story, next we're going to hear from Naftali and really hear about, from the young men's perspective, about some of the challenges in finding work in the informal economy and how some of the social restrictions as well as police harassment have really made these challenges so profound. So Naftali, over to you.
I come from Mathare, that's a slum in Nairobi, and I'm doing a degree course in public relations and communication. I love communicating. I love doing something which we let other people know about stories, the untold stories of maybe our area. That is what I aspire to do, at least to document issues that really affect us as people of the slums. Well, before COVID, life was easy on my side because back in school I was working part-time. I was selling sausages, and it was really bringing money, and it was able to pay. I was able to pay my rent and my mom's rent back at home. We have 3 siblings, and my mom is a casual laborer. So mostly she was able to do her stuff, and I was able to come in whenever I could. Well, when March 13th, when the president said there'll be a curfew the curfew which was impounded really affected us because we were sent back home from school. So like right now I'm home, and there was no hope of what exactly people are doing. The months were very difficult. Issues with the police, there was police brutality whereby they'll just apprehend you for no good reason, and then they were harassing us in each and every way they felt like, because whenever it reached 6:30 in the PM, if they found you walking, they will arrest you because maybe it's 30 minutes to 7, and that really affected me personally. And so we've been up and down, but I really thank God. In August, I tried to look for a friend of mine who is a photographer. He's from around and is a well-known photographer. I requested him to teach me his skill because there's nothing I was doing at home apart from working in a construction site. So I decided to look for the guy so that he can teach me camera handling and photography and videography. It was something which I was excited to do. Actually, I am excited to do right now because I think it is going in line with what I'm studying, and just communicating using pictures and videos and motion, that is. whenever the person had events and gigs, we could go with him as his assistant, and that's how I learned more about clients and stuff. Well, apart from that, I've been having my own clientele, whereby I hire a camera from that friend of mine. I go and do the photography. I hire his laptop. I edit the pictures, and then I send them, and then they send me money. That's how I've been surviving from August till now. Well, I've not gone back to school yet. I'm still saving money so that I can go back. Well, obviously, I can't go back and do what I was doing earlier because I was working for someone who has closed the business. Well, I think I'm trying to look for someone where I can hire a camera so that I can go back to school with it, and then maybe do photography there, maybe videography, to see if I can get money to pay for my rent, to pay for my personal basic needs. Well, apart from that, I would like to continue with my course and do great in whatever I'm doing, which is public relations and communication.
I want to take just a minute to really thank Naftali for that sort of sharing about really what the experience of COVID has been like for his own experience and that of his family. And I'm thrilled that we have a chance to hear about sort of the new skills in photography and some of the newer opportunities that have come along. And I'm hearing that he intentionally sort of set that ending up for us. So wonderful. I'm thrilled to turn us over to the panel discussion for this next segment of our event. We have Dr. Nancy Glass, professor and independence chair with the Johns Hopkins School of Nursing, and my co-chair. We co-chair together the gender equity and justice element of the Alliance for a Healthier World. And so I'm really thrilled. She's going to be introducing, moderating our panel, and we have just an excellent gathering of real experts with different types of expertise and lenses on gender, women's empowerment, equity, and health. So Dr. Glass, over to you.
Thank you, Dr. Decker. This is a real honor, actually, to have the opportunity to moderate this panel of such an esteemed group of leaders and experts. What I'd like to do is first introduce our panel and their area of focus and work, and then I will leave some questions that we've received and developed and direct them to our panelists to start our discussion. So first, let me introduce this amazing group of speakers and discussants for today. So let me start with Julia Mwabi. And please forgive me if my pronunciation is not expert. But I'm going to do my best. She is the gender advisor in the executive office of the President of Kenya, where she works on policies that are aimed towards ensuring that women and girls are not left behind. She has an expertise in policy and communication for over 15 years, working and leading implementation of community strategies, both in development and in public health. Our next panelist I'd like to introduce is Dr. Anne Chiara, who's currently the president of the African Federation of Obstetricians and Gynecologists, which provides oversight to 33 African countries in collaboration with their professional organizations. She is also the president emeritus of the Kenyan Obstetrical and Gynecological Society, a fellow of the College of Obstetricians and Gynecologists, senior lecturer of the University of Nairobi Department of Obstetrics and Gynecology, and a consultant obstetrician gynecologist. Next is Dr. Grace Ngari, is a renowned gender scholar and the immediate past director of the Center for Gender Equity and Empowerment at Kenyatta University. She is also now leading the policy and advocacy group at the newly established Women's Economic Empowerment Hub under the Bill and Melinda Gates Foundation initiative, What Works for Women's Economic Empowerment. Next, Anne Gakira is a senior technical advisor with LVCT, which is an NGO which implements programs on HIV testing, prevention, care, and treatment, as well as has significant expertise in the prevention and response to gender-based violence. Her expertise is in equity, gender mainstreaming, and prevention and response to gender-based violence. And our last panelist is Virginia Inducta, is the executive director of the Women's Empowerment Link. This is a women's rights organization which mission is to advance women and girls' social, economic, and civic rights. Virginia is a program specialist with over 10 years of experience working in gender governance, public policy, and advocacy. I'd like to just welcome all our panelists. This is a great opportunity for us. So first, just to get us started, we've had an amazing presentation from certainly the voices of young people in Nairobi, also their voices through survey data and qualitative interviews. Now I'd like to just start with, I think, one of the most important challenges, and I'm going to direct this to you, Julie, is thinking from a policy perspective, a gender policy perspective. What can you share with us as the current gender policy goals that you are working with the President's office, and how do we help you advance and align these priorities? Thank you.
Thank you, Nancy, and thank you, everyone. It's great to be here. It's really interesting just hearing from Faith and the data you're collecting. I mean, the Office of the President has prioritized adolescents and the youth. The President is actually leading on some key things, including the Generation Equality Forum that's coming up. There's one on Global Partnership for Education, the UHC, Generation Unlimited that focuses on the youth agenda. So there's a lot that is, a lot of work streams that are focusing on the youth and young people and adolescents in particular. I think one of the things I'd say is when you look at how the work that covers adolescents and young people, a lot of it is very siloed. So you'd have what's being done at the Ministry of Health, maybe the reproductive health is falling there, and the mental health. Then you go under the Ministry of Gender that maybe will touch on FGM. Then you have, let's say, the sanitary pads distribution that falls under Ministry of Education, and we're not really clear where. Then you have Ministry of Social Protection that handles issues around protection. And essentially what we are seeing is a lot of investments are being made in these pockets, but these investments are not speaking to each other. And I think one of the things that is a priority is to develop a policy agenda that demonstrates this comprehensive, sustainable, and a scalable approach. So, for example, we are now working on close to a similar study on the impact COVID has had on adolescents. And key things are coming out. For example, issues around nutrition. And we are asking, so who's following up on this? A lot of, you'd hear about the transactional sex you've mentioned, and you'd hear some of the girls saying, I did it because I was hungry while in school. I was able to get meals in school, but I've been home and I've not been able to get food. So recognizing that we need to get to a place where these investments are actually speaking to each other. And until we do that, I think we'll continue working in our silos and going round in circles and not moving the needle forward. So I think, as you know, with the President's office, we are literally a year and just over a year of finishing the President's term. But then one of our priorities is what can we put in place? What is that roadmap that we can put in place that even as the next government comes in, it's something that we can build upon and that is comprehensive and essentially just gets people around the table, even as we sort of come up and developing our program. Even if you're just doing something on health, How do you bring the education factor? How do you bring the nutrition factor? How do you bring other factors as you're developing your program? So I think that is one of our priority areas.
Thank you so much. What a great way to start about how bringing all these expertise together in the comprehensive nature of our work. So that's going to take me right to Dr. Ann, because we were just mentioning adolescents and some of the challenges around just supporting themselves economically and the risk of unsafe sexual activities. And so one of the questions we have for you in your work is, as an expert in sexual and reproductive health needs, especially for youth, knowing that many of the youth continue to rely on coital-dependent methods, which are subject to gaps in access, and we're seeing people having less access. How can we make longer-acting methods more appealing and feasible for our youth?
Thank you very much, and thank you for having me. I think I'll really just continue from where Julie is speaking. I think the biggest investment any country can make is in family planning. And why do I say this? Family planning is actually the tiebreaker. Get the babies you want when you want them and when you can actually support them, because it's a vicious cycle. There's a continuum of care. Today, I'm an adolescent. I'm grappling with looking for jobs. I really like the two skits that you showed and shared with us. You're grappling with looking for a job, getting something that's going to sustain you. Now look at the girl. She has the other added dynamic of now getting into a pregnancy or getting impregnated. Unfortunately, for the majority of them, there is the whole issue around now what we're looking at as the brain development in adolescence. What you prune and you groom, you literally end up with a sexual, either enjoyment or a sexual problem. Family planning comes in to actually put that stopgap. So with the long-term family planning, I would be very careful even within our context. Why do I say this? When you look at the younger adolescent, unfortunately, STIs and HIV are equally rampant. So I would begin right from the outset, say yes, put in a long-term method, but please let it be dual. Because I think first and foremost is informing them, educating them, but using channels that make sense, particularly to the youth. They are not a reading society. They're a listening society mainly, and they're very particular with language use. I don't speak Sheng, but a lot of the Kenyan youth understand that as a language of communication. So we need to come down to where they are, those of us in the policy environment and in the education environment. Number two is to understand, if you do get pregnant, are you able to support this child? Are you able to even return back to productivity as the mother of this child? Or do you end up with abject poverty? So again, I'm saying it's a tiebreaker, because at the end of the day, when you think nutrition, you think health, you think reintegrating and going back for education, particularly now with the COVID and the teenage pregnancies that we have had. How do you tie all of this and still give them a livelihood where they feel that there is one, integrity, two, they're making decisions for themselves, and three, can gainfully participate towards the development of this nation? I think it has to really be looked at in a cyclic and continuum of care. And last but not least, where are the men? Prof. Gishangi alluded to this, but where are the men? And where are the boys to take responsibility once they have impregnated the girl? So this ties then with the judiciary system and even the policing system, because we also see there's a major gap, even when we as gynecologists are really keen in knowing that this could have been an act of gender-based violence. How do you get the perpetuator to actually go through the acrobatics of the law such that this girl feels that she's back in a safe space? Because I think we really need to have that full cycle addressed. And multi-sector approach, I don't think health anymore can sit and say we're in that miasma of we know it all. We really have to broaden it out and get the communities to be engaged, and more so the youth themselves I could tell from this skit that the two of them, they have a lot of energy. What they're looking for is harness it and direct us so that we have gainful, sustainable livelihoods, but at the same time can propel ourselves to the next level. I love most about it is they still have hope and not hopelessness, because we also have the other problem, which maybe your study didn't bring out, but substance abuse and use and misuse, and even the engendering that's going on around there. We really need to widen the scope and the net in areas that we can actually work together.
Thank you so much, Dr. Ann. I agree that the students have a lot of passion, but I also agree you have a lot of passion as well. So let's follow up on the economic points that you brought up. You know, we had some really clear information from both the data and the stories about the economic impact of COVID. So Virginia, could you talk a little bit about what types of programs and policies you see that would be best address the disparities that we saw from the stories? And what programming would you want to see scaled up?
Thank you very much. And I'm grateful for even the highlights that have come out, particularly highlighting the economic impact to the youth and especially the young women. I mean, from the kind of programming that we've had, we've been able to also, identify some of these particular challenges. For example, the loss of human capital. You can see that during this pandemic, a lot of young women, because they had directed their efforts towards, the unpaid care work, they did not have time to get skilled labor, and this will have a long-term impact on what we will look at in future in terms of access to human capital, and this needs to be addressed. And then the other thing is that this would further entrench or further widen the inequality gap. So there's already the inequality gaps, which is very gendered. So the inequality gap between young men, young women, and looking at poverty as an intersection. And then, of course, the increased burden of care, specifically because we've seen that even as we're talking about early teenage pregnancy, it continues to entrench that burden of care. And this is something that in terms of programming, this would need to be addressed on what programs, what policies. We know that our county governments, for example, have the duty to look at the early childhood development. So in terms of their policy response, this is something that requires to be looked at, because not just from the age of 5, but from the age of 0. And just looking at how can the county governments respond to this in terms of childcare. And then, issues of gender-based violence have also been looked at. And this continually also affects the economic stress within the households. So in terms of programming, one of the things that needs to be emphasized is, of course, the access to basic rights. So in terms of loss of access to nutrition, access to childcare, access to shelter, these are basic rights and they cannot be compromised. And therefore, any programmatic response needs to know this is right. It's a right. It's not. It's not an ask. It's not. It's just a right, and therefore this needs to be looked at. Then there is nothing that can be done for the youth without the youth getting involved. So any programming needs to ensure that the youth voices are captured. So are youth represented in any COVID response programming that is coming up? Are their voices being heard, not just heard, but are they being integrated? And is anything that they're requiring or requesting for or demanding for being integrated in the programming? Because we've seen that unless we use the lens, especially the young women lens, in programming, then we are going to lose a lot of, we're going to have a one-size-fits-all kind of a program in terms of responding to the needs, and also when we are programming and when you're coming up to the policies. So the youth lens, specifically the young women lens, needs to be articulated very well in any stimulus package, in any social assistance program. And further to this, because there are quite a number of access issues that need to be sorted. In addition, in terms of access to technology, and technology has been used to leverage a lot of either services or also amplify young people's voices. There is need to look at technology, its access, because a lot of, especially the vulnerable youth, continue being left behind. So even as we use technology, then there is also need to look at other non-tech approaches that can help young women, young men access information, access markets, and access, be able to exercise their day-to-day, either income generating or access to education. I mean, in terms of also looking at safeguards that need to be looked at, especially in the school system. So now, right now, all the schools are open, but there is a recovery that, and especially around, counseling and talking to the young women, and helping this through the school system. So there needs to be safeguards within the school system, within the learning institutions, that need to be looked at and need to be systematically programmed so that the young women, the young men can continue to recover after COVID. And there is also need, again, I want to emphasize, need to continue amplifying the needs of those that are most left behind. Because when you look at the vulnerability and the intersection, we are seeing, for example, in some of our programs, there are those that have just been lost in the, in the cracks, because they either were in, for example, I know that one of our young lady who gave her testimonial, she is now living in a slum. There are those that were living in a slum area, now they have already migrated. Most of them have migrated maybe into a rural area. There is need to continually monitor their vulnerabilities and continue amplifying their voices. And therefore, this calls upon organizations like ours, which are women rights-based organizations, to continue amplifying the voices of those that are most left behind, and their voices may not be represented in any program, in any policy, and continue amplifying them to ensure that any social protection measure that the government, for example, comes up with, or the county government, or any other civil society organization, does not marginalize them further. And that is it from that.
Thank you so much. Thank you, Virginia. Such a complex and big topic, and we really appreciate how you were able to really summarize some of the key challenges. So now, and you brought up in your talk some challenges that we'll move to our next panelist. I'm going to start with Anne Gakia and ask about one of the issues that Virginia brought up was gender-based violence, and we saw that certainly there's violence in the household, but we also saw a lot of concerns around safety, external safety, and some link to the curfews. Could you talk a bit about challenges around prevention of violence and during the pandemic and work that's ongoing, and then particularly issues around intimate partner violence, if you would?
Yes, sure. Thank you very much for the invitation and for the speakers before me. Mine is just to really build up on what has already been said. As we've seen with the global data during this COVID pandemic, the recovery and the response, measures that have been put in, like the curfew, what we saw a lot of was young girls, adolescent girls, young women being locked up with their abusers in the house. And this meant that they could otherwise not be able to access services that they would ordinarily access pre-COVID. There was a curfew that restricted movement during certain hours of the night where we know predominantly is when violence actually occurs. So you'd have people being beaten, experiencing physical, sexual, emotional violence, and they had nowhere to turn to. Particularly in Nairobi, we had sort of like the area cordoned off from the rest of the country. So there was a lot of disruption in the social networks. Families were locked out, mothers, fathers, parents, and protective figures were locked out. So then that meant the children who are at home, the adolescent girls and young women, are at a risk of experiencing this violence. There's a lot of tension in households and loss of jobs. So this is not unique just in Kenya. This is something that we were able to see globally, and the UNFPA were able to give the statistics of how the longer we are in this curfew period, the longer we are in this lockdown period, the more cases of gender-based violence we are going to experience. So when it comes to preventing that, or how to support the youth to prevent violence, we'll still have to look at the socio-ecological model. There's no way escaping that when you're coming in, when you're discussing about prevention measures, only that this time it will be slightly unique. What we normally find a problem with prevention strategies that we assume one size fits all, and we certainly know that the youth and the adolescent they're a whole different mindset, a whole world away from how we are thinking. And more often than not, it's us who come up with ideas of how we can prevent the violence that they're experiencing without being very deliberate in our risk mapping. So whenever we're looking at the socio-ecological model and risk mapping, we actually need to go on the ground and figure out what it is that is happening. Is it the myths that the youth are believe, like, for example, I'm being beaten because, I have no other place to go. This one provides for my rent, for my shelter. So really I can't go and report. Is it because we assume that youth violence or dating violence is a private matter? People are ashamed to go and talk about it. The survivors have certainly reported they find it hard to actually escape that kind of scenario. But we actually need to go to the ground and figure out what these risk factors are and protective factors are. And then using the socio-ecological model, it's trying to identify what strategy would be able to fit in. I like what Mr. Kishangi presented on mothers being a resource. Now more than ever during this COVID period, we realize that things don't work or did not work as normal, where we have access to the health centers. We suddenly realize the need of technology and how to utilize it, leverage it in our everyday working, and more so at the community level, that we need to invest in these community structures where our adolescent girls and young women and men live, because the ordinary services were either prioritized for COVID response and nothing else. So it was great to see that mothers were a resource, and certainly those are some of the prevention strategies that we need to take into place. We need to invest a lot in youth building, like social asset building, especially now that things have been disrupted, mentors have been separated from the adolescents, people who they'd look up to. We need to invest in the champions at community level, people who the youth can relate to. So reaching out to the community-based organizations that perhaps work with the youth in that community to be able to reduce some of the risk factors, or certainly advocate for the eradication of violence amongst them. We need to invest in safer environments. Now that we are going back to school, schools have always been a protective factor, but right now, for example, in Kenya, there is some shift that's gone on where violence is actually occurring within the school environment, where these children are going day in, day out. So we need to be very deliberate and put in interventions that would actually address the violence in the schools, violence within the household. So a lot of parenting programs, a lot of, again, social asset building to address the relationship issues that the youth might have in that intimate partner relationship. We need to look at the society as a whole. This whole issue or myth of violence being a private matter. We need to raise awareness at community level to allow the youth to be able to speak out so that they can actually seek the services that they ought to, to get and need to be reported, and, there are psychosocial support being offered to them. So when you're talking about some of the challenges that they're experiencing right now, we need to look at that sort of model and come up with very deliberate interventions for the youth, and more importantly, by the youth as well. I like how my colleague has just said how we need to have meaningful engagement when it comes to developing these interventions. More often than not, they're normally just consulted at the beginning of developing these interventions. They need to be part of it throughout, from the design stage, participatory approaches. They're the ones who are going to be champions at community level, not being left out where we just harness the information from them and then develop something for them. There's nothing for them without them, and that's the way to go forward with any intervention for violence prevention or policy making as well. Thank you
so much. You know that you're talking about the education and Kenya students going back to their universities. I want to now turn to Dr. Grace, and as an educator and now leading a women's empowerment hub at Kenyatta University, to ask about how we saw in the stories, especially around learning new skills, becoming a photographer, using those skills for economic empowerment. And so how do you see that the pandemic could also prompt gender equity? I mean, we've heard a lot of challenges within this pandemic about negatively impacting women and young men, but let's talk about how it could actually prompt gender equity in the work that you're doing.
Thank you so much, Nancy, and all the other panelists and the participants. Well, the first thing I want to say is that when I thought I'm going to speak in this panel, I spoke to my students about it. And I asked them, where is the terrain? Where are we? And one of the things that came out very strongly, and I'm glad you're asking that question, is pandemic was like a self-discovery. It led people to self-awareness. You know, you could be in a slumber, and I think the generation that we have, especially the generation that is in the university, this is the ages between 19 to 25 maximum. This is a generation that has been raised, especially in this country, and the only challenges they knew was joblessness, unemployment. And this already existed even without any pandemic. And then suddenly there comes like a stopgap, a warning, pandemic comes, COVID-19 comes. The first thing, for example, that happened in the universities was ultimate closure immediately, no warning, no nothing. COVID came, I think, on a Thursday. That's the first case, when the first case was detected. And I think within 2 days, that was on a Monday, that was only 3-4 days, there was total closure for the university. And students and professors were all told to go home. And the homes that people were told to go to, remember when we started here, we started about technology. There were homes whereby within 2 months, we were told we can now start learning. And the starting of learning is learning through technology. These are students who are scattered all over the country. If I may inform you that I don't know what percentage of Kenya has electricity. Technology needs electricity. I don't know how many of our students have mobile phones, and in that case, smartphones. And therefore, COVID disrupted the mindset of the young people, and both boys and girls. And in the context of that, the mind became void. And when the mind becomes void, it creates. So where are we now? Where were we in March, and where are we now? Of course, there has been a lot of challenges. And these challenges, may I say, are also gendered. Because access to technology within the family, because of the socio-cultural structures, institutional structures of the family and all that, also manifest themselves from a different gender dimension. So what I may say is that COVID, with all its negative part, has also created a new dimension of creativity. We have woken up, and the young men and the women have also woken up. You have had both speakers, or in the videos, what they say. I can borrow a camera. I wish I could know where I would hire a camera, go back with it to school and do ABCD. That to me is a new opportunity. I have found that a lot of students, especially in my own classes, who are telling me we have learned that we are not going to be caught again unawares. So what are you doing? And you hear the kind of challenges that they are facing. I am doing this. I have realized education alone is not enough. This I have to do, doing so many things that may help survival. So what I would say is that much as we are lamenting about COVID, and it's true, it has a lot of negative impact, I also see a lot of positive impact. And the first one I've said, opportunity to re-examine, identify, gendered economic opportunities. What can women do? What can young women do? What can young men do? That is in itself is very positive. The pandemic has also created efforts, and I'm glad we have the person representing the office of the president. New challenges that come. For the first time, the government, I guess, has realized the inequalities within our technological system. And this is something that we have to start addressing. So for me, I think the diversification of business and the diversification of livelihoods, it's new opportunities that COVID has brought in. Again, it has also brought an awareness that indeed, with the new normal, we are calling it the new normal, the near new normal. What do we do? How do we fit in? COVID has put both young men and young women on different paths. And it's a high time now we start filling those vacuums. So any strategies, any opportunity, including policy, and you ask me what I'm doing in the hub, we have to now re-engender the policies and finally think about mainstreaming COVID, gender mainstreaming within the COVID policy. We cannot work like we are not aware we have COVID. In the universities, as I heard right now, we are having two different modes of learning, whereby students are alternating. You will have those who run online for a while, others are running face-to-face, and within 2 weeks, 2 months, they alternate. The online come in to catch up on what face-to-face. This is something we never knew that would happen. We are teaching online, and we have graduated students online. We are conducting programs online. And to start with, it was sounding like it's almost impossible. It has now become what we are calling the new normal. So to conclude, I would say this, that we need to readdress this, take in the opportunity, stop seeing COVID all from a negative perspective, because I think this has been the narrative for a very long time. But now rethink, refocus, and see what is the way forward. We have learned that we can Zoom like we are doing. This was not normal a few days ago. Now we are conducting meetings all over the world. And therefore, I think if we do an analysis, and I think this should be our next research because we are researchers, what are the new opportunities that COVID-19 has created for us in the world, for scholars, for our young men, for our young women that they can tap into? And maybe that will be the normal. We may not even want to go back to what we were, or to go back to the world that we were in. Honestly, let me tell you, as I wind up, I'm finding it very hard to go and face students and teach them. I'm finding that a big challenge because I have to drive, I have to go through traffic. Whereas I have realized in the comfort of my bed, I can deliver lectures. Thank you.
Thank you, Dr. Grace. Yes, I think everybody here is appreciative of the Nairobi traffic. So I wish we had another hour to discuss among this expert panel. But we are going to have just a few more stories after this. I think will really help solidify the expertise and the wisdom that our panelists provided us. Just want to highlight some key messages that I think our panelists shared with us, and that I heard loud and clear as we take our next steps in the pandemic and moving forward in policy across multiple sectors, from health, education, and economics, etc. So from the policy perspective, we're looking at reducing the silos, reducing sector specific programming and policies, a more integrated and recognizing the intersection of gender, race, class, economics, all of those disparities that we're experiencing as a global community, and how do we move towards equity by working in collaboration. That also we talked about, especially around gender-based violence, the socio-ecological framework, how to recognize that we need interventions and programs that address the individual's need, as well as the family, the surrounding community, and society, looking at norms that, and gender norms and social norms that really drive how these inequities in our societies. We also learned from the passion of Dr. Ann around the engagement of youth, the critical engagement of youth from step one through the end to leading the dissemination of these programs. And then, of course, our colleagues leading off with a really positive, I think, message of where are the opportunities and how can we mentor youth and reflect on this time and really embrace their persistence and passion as they take on these challenges in the new normal. So I'm going to hand it over to Dr. Decker as she introduced the next storyteller. And thank you so much to our amazing panel. We hope to do this again with you soon.
Wonderful. Thank you so much, Dr. Glass, for just an excellent moderation. And I want to just echo my thanks for the panel. It was just such an honor to hear from such diverse disciplinary perspectives and hear the uplifting of the human rights lens, as well as the resilience and the optimism and the passion which we can approach the future with. And I think the next arc of these stories is going to give us, from the voices and perspectives of youth as well, again, a grounding into those experiences and then ending really on truly a note of optimism. And so I'm really pleased to introduce our next story. Next, we're going to be hearing from Maureen Bouvi. She is 22 years old. She's living in Nairobi, and she's going to talk about how COVID-19 has affected her pursuit in a degree of economics. And as we've heard, this is such an important and very timely field for us to have the engagement of youth. So Maureen, over to you.
I have always been good with numbers, and I had this dream of becoming an economist since I was young. In 2016, I received a confirmation letter from Kenyatta University to undertake a course in economics and statistics. It was a dream come true. My dad had left when I was 4 years old, and my grandmother took full responsibility of me then. She was the one who took care of my education finances and provided for everything that I needed. In June 2017, she was given an early retirement due to her prolonged illness, which made her unfit for work. I had to juggle between attending classes and taking care of my sick grandmother. Things got out of hand because she was the sole breadwinner at the time. We were forced to use her retirement benefits to pay for my second semester fee. I had now to walk to school because she could not afford transport and large money and also cater for her medication. Unfortunately, there were no enough finances to pay for my third academic year, and I had to defer for a whole year. I stayed at home taking care of my sick grandmother. I felt like my dream had been shattered. Things were not easy for us at that time. We used to skip meals at times, and my grandmother could not afford her medication. Purchasing sanitary towels seemed like a luxury, and I was forced to seek other alternatives and stay indoors. In September 2019, my dreams were brought back to life when my mom offered to pay for my school fees. She had secured a job as a hairdresser. The worst happened in March 2020 when the first case of COVID-19 was confirmed in Kenya. The government came up with strict restrictions that forced many jobs to shut down. Many people lost their jobs, my mom included, and she could no longer support us. Due to lack of proper medication and a balanced diet, my grandmother's health deteriorated and forced my mom to take her in, where they still live with my stepdad and two of my siblings. At that time, I was desperate for any kind of job. Luckily, I secured a job as a cashier in a pharmacy with a low wage rate of 3,000 Kenya shillings and a shelter at my employer's house. I faced many challenges there. We used to close the facility 30 minutes before curfew, which was 7 p.m. As a young woman, it never felt safe going home at that time because it was late. People were rushing to beat curfew. At times, you could find a stranger offering a ride home, and definitely I declined for the sake of my safety. The curfew was then extended to 9 p.m., which forced us to extend our working hours to 8:30 p.m. I could leave from work exhausted, and upon my arrival at my employer's house, I had to do house chores like cooking and doing dishes. I used to sleep late and wake up very early so as to do laundry and make sure I get to work before time. I felt like they had taken advantage of my gender. Despite all of my challenges, I used my little salary mostly on my grandmother's medication. This made me proud of myself. Due to the government restrictions, the pharmacy could not operate for 24 hours. And the employer was not able to pay all of us, so she was forced to let some of us go. Losing the job made me feel frustrated because I was the one providing for my grandmother's medication and taking care of my needs. I've tried seeking jobs through friends and families, but my efforts have been in vain. There's one time I went to seek a job in a airline industry. But I got no one's attention for days, and so I gave up. I was forced to seek shelter at my boyfriend's house, where I currently live. Life in the slum is not easy for me. It is unlike the place I grew up in, where I felt safe. I could move freely and go visit friends. However, here I'm forced to stay indoors all day because as a young woman, I never feel safe here. There are strange things that I see in the evening with the company of my boyfriend when we are going to buy supper. You'll find young men walking around smoking pan, fights erupting. I see a lot of pregnant teenagers, and what makes me wonder and ask myself so many questions is seeing middle-aged women drunk, others with little children, and others lying by the roadside. And I wonder what the future holds for their children. I hope that someday I will be able to empower these women, because some of them seem full of depression. Life has molded me into a different person, and I now see life in a different angle. I hope that I'll be able to go back to school soon, finish my study and pursue my career, so that I can support my family and empower young girls and women in the society at large. Despite all of my challenges, I believe by the power of a strong woman that I will emerge as a victor. Thank you.
Wonderful. Maureen, thank you so much for sharing that with us. And I share the challenges and also the optimism that you have for the future. So I'm so thankful again to have the voices of youth joining us through the storytelling. Our next story we're going to hear from David. David is 21 years old, and he's going to be sharing his experience with COVID, including some of the harassment experiences from police that occurred during sort of this economic challenge, and within that work to really support the family and the role of police in making that even more difficult than it needed to be. So David, over to you.
Okay, when I came to Nairobi in September 2018, my main aim was to join the university. My dream course was to study land survey due to my hard work in high school. But then things never went right. It wasn't successful. I had to find another way to survive inside Nairobi. So I got a chance as a teacher. I was teaching a local private school, primary level, that runs all the way from the 1st grade to the 8th grade. So I taught there for the year 2019. I taught in the year 2020. So I was majorly teaching to save money for my own upkeep and to save for the university. So my plan was after 2 years, I would have saved enough money to continue with my studies, but it never went well when 2020 approached. Coronavirus broke out in the whole world, just like it happened in every place. And then there was that lockdown, schools were closed, and I never had a source of income. So I had to struggle. The first few months it was good, but then as time went by during that lockdown, things went harsh, and I had to use all the money that I had saved for the university for my own upkeep. I had to move from the house I lived to a less cheaper one. Then also just sitting around roaming wasn't good for a man like me. So I went out to search for a side hustling. This time round, I worked, but it wasn't successful. But after some times, yes, I got one, but it was in a certain workshop within Nairobi CBD. So the main job there was to distribute this steel, the metals, to their clients. It was good though, but we only had one challenge because at this time the money was little. 2, you had to go long distances, of which the transport is on you. And then it wasn't easy because sometimes the curfew was imposed at 7 a.m. The curfew time would catch you up when you've not reached your home. And you had to fight the police officers at a moment, because I can remember there were times when I was apprehended by the police at the curfew time before I could reach my home. I was beaten thoroughly, the way they harass young youths like us, if you compare to the feminine, the men, they're being harassed, they're being beaten. So I was beaten thoroughly. Then I was taken to the cell. So that night I spent a night inside the cell, hoping that the next day someone would come and rescue me, but no one. So I had to spend at least like 3 days. So the third day, I had a friend who rescued me, so I came out of the cell, then continued with the same job which I had, because it wasn't simple. You have to survive, you have to work, you have to get money, you have to pay for your bills, you have to buy food. All those just on me. Then at times also, apart from being arrested, there are times where I slept outside. Not that I never had a house. I had a house, the rent was paid, but the only problem was due to the curfew, because I had to hide from the police officer. So you have to spend the night out, because if they catch you just loitering around, you'll be another bait again. So it wasn't easy dealing with them, but still, all that has the beginning, has the end. So Corona, it has not ended yet, but still we are seeing the limelight. So when the lockdown was removed in Kenya, the curfew time was reduced to 10 p.m. Things again started becoming ease, though I still had to struggle from where I was working. But thank God in 2021, schools were open, and I've gone back to where I was, the job I'd been doing currently, and that is where I have been up to now, still having the plan in mind that I need to save for the same course, the land survey, which has always been in my mind ever since I was a young boy.
Wow, thank you so much for that, David. We really appreciate you sharing those experiences. And as we were hearing about the police violence in particular, I was called to mind the framing again from Virginia on bringing that rights-based approach and that rights-based framework. It's important for all of the things that we do in public safety and in public health, and is very much at the fore when we're talking about pandemic, right in the moment, as well as the recovery efforts. So I'm going to take just a minute here to do some final thank yous and transition us. We do have one more story, and I encourage everybody to stay on for this. We wanted to do with the close of this seminar was to really end on just a really high note of resilience, and opportunity. We have many challenges ahead when we think about the COVID response and the gender equity that has been brought to light both during COVID, pre-COVID, and as we think about moving forward. But I think today what we've heard is a lot of cause for optimism and a road forward, together with the voices of youth, together with the voices across pillars and silos, and really kind of coming together for that interdisciplinary approach. So I do encourage you to stay on for this last video. And just before I close, I want to really give my hearty appreciation and thanks to our panelists, to our moderators, to all of our presenters, and very much to our production team, all of our collaborators at ICRHK. I know many of you are on right now, so thank you. Our team at Johns Hopkins and at the Alliance for a Healthier World, who has really helped to bring all of this together for us today, and certainly our Stoop Stories as well. So it's such an honor to have this opportunity in this space to be together. So in closing, I am going to invite you to take in this last story. This is the experience of Lydia. Lydia is 22 years old, and she's going to actually share her perspective on how COVID has opened up actually some new work opportunities, including a mentorship program that is specific for young women and girls. And I think this is an area that we can agree is a really impactful and meaningful path forward. So thank you. Lydia, over to you.
After finishing college, I stayed home for some time. Then a friend of mine hooked me up with a job at their company that manufactures biscuits. I went for an interview, and in the interview I passed. I was employed as one of the workers who were packaging the biscuits into boxes. The salary in the company was good. I was able to pay rent in our house. I was able to do shopping in our house. I was able to buy my own clothes without asking anyone for money. I was able to go for hangouts with my friends during the weekends. I worked in that company for the whole of 2019. But when Corona started, the demand for biscuits went down. Now the manager of the company had to terminate some workers. Because I was not working under any contract, I was one of the people who were terminated. So I had to come back home. I had no savings at all because I have never learned how to save at all. I'm not a person who believes in saving. When I get money, I use it all without thinking, what will I use for tomorrow? I just use the money as it comes. So when I came back home, I had to depend now on my mom, who is disabled, be it personal effects, be it food, be it rent. She was the one who was providing, because now she had to start a small business for selling the smallest fish outside our home. So we borrowed the money that she used to start the business. We borrowed from my aunt, who gave us the money. So the business was good. I was the one helping her to remove the things that she was selling outside our home and staying with her while she was selling. But this made me very sad, because now she was the one who is providing everything for me. I could not do anything. Now I called all my friends from my contact list, asking them if they had any job opportunity for me, but no one had anything for me. So I was persistent. I did not lose hope at all. I just continued asking for job at any place that I could get. But by God's grace, when the president announced a national hygiene program that was employing youths to clean the areas where we lived, so I applied for the job. When I applied for the job, by God's grace, I was taken as a supervisor. So we started the job in the end of July. Our work is to clean our areas, make sure the trenches are clean, make sure there are no garbages in the area, so that the rate of corona could reduce. This is what I was doing up to now. This is what I am doing. We clean our areas, make sure. While working in the National Hygiene Program, in the end of November 2020, another friend of mine hooked me up with an NGO called Hope Worldwide, where they wanted mentors. I had never been a mentor before, so I opted to try. I just wanted to try. So I went for an interview, and in the interview I also passed, and I was taken as one of the mentors in the NGO. We went for a training for 1 week. and the NGO deals with girls only. So every mentor was given an age cohort to mentor. I was given the age cohort from age 20 to 24. In these mentorship programs, we teach girls how to abstain, how to use family planning methods, where to get these family planning methods, how to deal with GBV, where to find help if one is faced with GBV at all. So during the weekdays, I go for the national hygiene program, and during the weekend I go for the mentorship programs. We mentor girls on the weekends. We talk to each other. We know each other well because now we are sisters. We tell each other our life stories, how to live as a woman, and this really made me happy because in my life I've never thought I'd be a mentor before. I've never even thought how to talk to girls before, but this was my first time, and it has been it has brought a great impact in my life. Now people look up to me. They can come for advice when they want. They can come to me when they have any problem. We talk as sisters, and I will say Corona came to me as a blessing in disguise because now I am a mentor. And also, I have a job. I am a supervisor for the National Hygiene Program. I cannot complain much because Corona came to me as a big blessing. But then again, even though Corona came to me as a blessing, it also disadvantaged me as a gender because when the president gave out the ruling of the curfews, I was not able to meet with my partner. And before, I was used to meeting with my partner at any time I wanted. But now, when the curfews were put on 7, I was working. I come from work I go to work from morning to afternoon, and then it was hard for me to meet with him because the curfews are at 7 and he lives far away from me. So it has disadvantaged me as a gender because I was not able to meet with my partner. But I am very happy to say now I am a mentor, even though even though my dream of becoming a financial interpreter has not come to true yet. I'm happy that I am a
Wow. So Lydia, really giving us the light and the voice here on some of the disruption of COVID that can create opportunities, not without challenges, absolutely not without challenges. But as we go forward in the world today, and as we continue to carry this work forward, we can really be thinking about the interface of economic empowerment, gender-based violence prevention and response, the rights-based approach, and really, again, lifting up the youth voice within all of our policy and programmatic responses as we move into this recovery mode. So again, thank you. Encourage you to continue the conversation on social media. And thank you so much for being part of this event today. We're thrilled to have the opportunity to reflect together. Thanks.